Well, thanks for staying with us here on The Pulse. So other stories now, the Electoral Commission has declared Professor Alidu Seidu Mahama of the NDC as Member of Parliament for Tamale Central without holding any by-elections. This follows the opening of fresh nominations by the EC after the death of the former MP for the area, Alhaji Dr. Ibrahim Mutala Mohammed, in the Ghana Armed Forces helicopter crash in the Ashanti region. At least 4 candidates picked nomination forms and 3 filed to contest. However, PNC and LPG withdrew after filing, leaving Professor Alidu Seidu as the sole candidate. The Electoral Commission subsequently reopened nomination, which later closed without additional contenders. Returning officer Muniru Musa cited C127 as the basis for declaring Professor Alidu Seidu as MP-elect without actually holding a by-election.
PG. Right after the close of nominations, they submitted letters to the returning officer indicating their interest in withdrawing from that contest. In line with CI 127, the Electoral Commission reopens nomination for another 10 days. That 10 days elapses only the day before yesterday, on Sunday. As it stands, it means that only Professor Alidu Seidu Mahama stands nominated. And according to the CI 127, with permission, I'll read. Where the time allowed for delivery of nominations has ended, and on the day before the elections, only one candidate stands nominated. The candidate shall be declared elected. In view of this, I, Muniru Musa, returning officer for the Tamale Central Constituency, in working with CI 127, hereby declared Professor Alidu Seidu Mahama as the MP-elect for the Tamale Central Constituency.
Let's go now live to the northern region and speak to our correspondent Martina Bugri, who's joining us live here on The Pulse. Martina, a lot of things happening in the northern region. What's the atmosphere like after the declaration of Alidu Seidu as Member of Parliament elect for the area?
Body filed, the people already concluded that he was the MP elect, and so they are looking at what he will be doing for them. When you speak to people, they are of the view that having stayed in Accra, worked with a lot of people, he has the connections. They believe that he'll be able to lobby to bring in more development to the area. They think he's the best fit to take the step of the MP who is late, because that's exactly what he was doing. And so people are excited that at least officially he's been declared.
And then finally, what key things has he said he would be doing to improve the living conditions of constituents?
So before he had been declared, he mentioned establishing an education fund in memory of the late MP. He's talking of adding senior high school extra classes for his constituents. The late MP was doing just the junior high school. He said he would add the senior high school. Skills training is one thing he said he would look at. Loans for women, he says he will look at. And he's looking at the broader infrastructure for the area. So he's cataloged a lot of things. He says that within the next 4 years, he'll be looking to bring to his constituency.
Thank you so much, Martina, for your time here on The Pulse. Well, away from that, the Environmental Protection Authority and Pure Earth are giving some more revelations over alarming poisoning of food crops and fruits in 6 regions across the country. A new study conducted by the two institutions in 6 regions, the Eastern, Western, Ashanti, Central, Western, North and Savannah region, has revealed that mercury, lead and cyanide contamination has moved beyond river bodies to daily staples like tomatoes, contomere, and now coconuts and mangoes. Listen to the program's officer at the Environmental Protection Authority, Hopsine Japan, who said out of the samples, Konongo Dumasi and Konongo Zongo have become the heaviest polluted areas, where even getting a contact with the soil in that area can leave one contaminated with heavy metals. He spoke on the Super Morning Show on Monday.
Prez has in the study is that Konongo Zongo, both Konongo Zongo and Konongo Odumasi, recorded highest level of mercury in the soil. In fact, we are talking about 1,342 parts per million. That is the highest level. Oh. Now, what it means is that when you come in contact with the soil, which we call in terminology dermal contact, your skin come into contact with the soil that is highly contaminated, you are exposed to it, and it can poison you as well.
Wow.
We're also looking at still in Konongo, we're looking at the water. The water, it's also has higher levels of mercury concentrations, and also arsenic. And of course, if you look at the food chain, you would see some of these contaminations in the food chain as well.
What is more worrying, according to him, is that food crops, including contomere, tomatoes, mangoes, and coconuts, are heavily contaminated in the same area.
I think this is scary, but I just want to urge calm. In Ashanti region, of course, Konongo, we look at the pawpaw, we look at tubers, we look at cocoyam. All of these exceeded the permissible levels of mercury, arsenic, and lead concentrations. That is really worrying. And of course, if you go to other areas like Western North region, Savannah region, Western region, we can see contomere, the values as high as 4 milligram per kilogram. That's high. The permissible level is 0.03.
Wow.
Hey. And then we see the same in tomatoes, as high as 4 milligram per kilogram. And then, of course, pepper in Western North. We see contomere as well in Western North. We see contomere as well in Savannah region. And so there's the coconut, even in coconut, mango. We see values as high as 1 milligram per kilogram.
In mango?
Yes. So this is really worrying. And of course, talking about the fish, we see a lot of arsenic. We see a lot of lead. The values for mercury in fish is below acceptable limit, but the challenge is that bioaccumulation. I mean, if you continue eating it in bits and pieces, it accumulates and can be very toxic to your body. So these are some of the things that we've seen.
Let me just ask, should we not be evacuating Konongo? I just want to know, is it safe for humans?
I mean, given the data and the values that we've seen, it's worrying, and it doesn't appear safe. But I think one good thing about this study is that EPA, from the data collected, working on policy briefs to come out with an action plan.
Well, environmental experts are warning of a full-blown impact of illegal mining operations on human health. Speaking to our sister station, Love FM, Executive Director of the Center for Environmental Impact Analysis, Dr. Samuel Obri, highlighted some consequences of the heavy metal on skin and health. Dr. Obri recounted how the burning of gold ore in the late 80s in Obuasi has now seen older citizens of the gold mining town battle unhealthy skin pigmentations.
Those older citizens around Obuasi can tell you that but there was no vegetation around the PCP plant around that time because the sulfur dioxide gas being emitted into the atmosphere, dissolved in the rainwater to form acidic rain, which causes the vegetation there to also extinct. And then there was also, the soil also became too much acidic, which was not too much tolerable to some other plants. And those who were inhaling it and other things also had to have other conditions. So if you go to Obata and you go to those older citizens, if they remove their shirt and you take a first look at the back, you have what we call hyper-skin pigmentation. The hyper-skin pigmentation. David, have you seen the Adisco school uniform?
Like the zebra colors?
Yeah, the zebra colors. So that is how their back looks like. Which means that there are also other people what we call the skin keratosis, where you have some small boils that normally are found around the toes, and then when it bursts, it has a very pungent smell, and when the soil is dries up or the soil is healing, it leaves with a very dark black scar that we call it the Blackfoot disease.
While the country hopes the government will take drastic measures to curb the environmental havoc, experts are warning and advising that the use of plants and specific procedures for water purification may be the way to go.
Yes, there are technologies to remove. So in the house, just the normal, for example, if your water is contaminated with cyanide, you know cyanide is photodegradable. So when you heat it to some temperature and you allow it to cool, or if you have some microbes in your water, when you boil it, it will cool down and then cool down, you filter it, you can also remove some of those contaminants.
Is there any other thing we can do to our water?
So when you have a ceramic filter, and then
you can have a filter, but that is not also, you cannot remove almost all of them. The moringa leaves, the moringa leaves can also remove it. The dandelion leaves, all these things can also take some of those contaminants from the system.
I see.
You can go by the chemical method, or you can use the reverse osmosis technique to also remove them, or the ion exchange method to remove them.
Away from that, head of the Pediatric Oncology Unit, Dr. Ernestina Shandoff, disclosed that annual childhood cancer cases have spiked from about 160 to over 230. Speaking at a fundraising event, she described this surge as deeply alarming, warning that unless resources and infrastructure are expanded, the unit's capacity to provide effective treatment will be severely strained. The unit currently treats cancers such as leukemia and solid tumors condition. Dr. Ernestina Shandoff says limited space and facilities are undermining the effective care.
Because our numbers have really increased. In the around 2014, we used to see maybe around 160 children with cancer every year. Now we see over 230 children every year, new cases, excluding the old children, the old children to be in the thousands. So the number of children has outgrown the unit. So we really need a bigger space to be able to make sure that we provide the adequate care for these children. It takes a village, that's the truth. So we are advocating through this walk for sponsorship to complete this building so that these children can have the space and we don't have to wait for them in the emergency room, wait for additional time that could impact the cure rate of these children. So I call on everybody, general public, corporate bodies, the government, the philanthropists, please come to the aid of the Pediatric Oncology Unit in Kolebu so that we can complete this building and have these children have the optimum treatment that they need.
Dr. Ernestina, who works at Kolebu Teaching Hospital, is also calling for stronger public awareness and early detection campaign, stressing that timely diagnosis can save lives and prevent cancers from spreading in children.
Early warning signs can resemble other diseases, but if you have persistent symptoms, if a child is having fever, despite your treatment, it's still not going, you need to consider childhood cancer. If the child is having aches and pains in the body, you need to have a suspicion of childhood cancer. If they're abnormal swelling, usually it can be painless, okay, and that's one of the early signs of childhood cancer, any swelling in any part of the body. Also, when you come to the childhood cancers of the eye, the retinoblastomas, sometimes all you see is a whitish dot in the black spot of the eye. It looks like a cat eye when you look in the night. So those are the early warning signs. The very late sign is when the eye becomes swollen and the eye is protruding. Sometimes even the way the eye is positioned, like if you have a squint, one eye is looking in one direction, the other one in the other direction, is also a possible sign of eye cancer.
You're also watching The Pulse. We'll be back after this quick turn. Please stay tuned in.